3 years ago, Mzee Abdullahi Nur Barre buried his younger sister, Bishara Nur, who died of throat cancer.
Alikuwa ameugua hiyo ugonjwa muda mrefu na alikufa.
Now the 65-year-old grandfather has been diagnosed with stage 3 throat cancer. His family could not inform him of his condition.
Hizi tulikuwa tunamficha, hatakuwa tunaweza kudisclose kwa sababu tulikuwa tunaogopa.
Abdullahi Nur Ahada has lived all his life in Arbajahan, some 150 kilometers west of Wajir.
Kwa miaka moja hakuwa anaweza kula isipokuwa kunywa nusu glasi ya maziwa. Baadaye hali yake ikaanza kuzorota, akakuwa hata hana uwezo. Kisha juzi alikuwa amelazwa hospitali ile dispensary ile Arbajan.
Neither Mzee Abdullahi nor his family suspected cancer was the problem. They ended up taking the wrong prescription in the early stages of the disease. It is very late for Abdullahi. Medics say the cancer has developed into stage 3 cancer, one of the worst forms of the disease.
Chakula yake ni drips. Hawezi kula na hawezi kunywa.
Most of the times we normally get at advanced stages when someone had difficulty in swallowing for the last 8 months. So most of the management we give around here is more of palliative management to patients with cancer of the esophagus.
After 10 days in hospital, Abdullahi still did not know what was troubling his body. He had lost hope of finding a cure.
Yeye mwenyewe anasema kama hakuna matibabu ambaye naweza pewa, na ile matibabu napata ni hii maji ambaye yanafungiwa, mnitoe nikufe kwangu nyumbani. Heri nikufe ndani ya watoto.
In another corner of Wajir, Abdi Isaq is preparing to travel to Nairobi to seek specialized treatment. Isaq, a father of 13 children, is among the few people in his village who have received formal education, something that has helped him discover the cause of his ailment.
Jamaa yangu akanisaidia, akanabeba na ndege, mimi na kijana yangu mkubwa tukapelekwa, alafu endoscopy ilifanywa. Result tukangojea for about 4-5 days. Then nikaona daktari hakuwa anataka kumweleza watu, alikuwa anataka kueleza mimi tu kitu. Mimi mwenyewe sasa nikakuwa na shaka, nikamweleza daktari mimi ni binadamu, kullu nafsin dha'iqatul maut, kila hai itaenda tu. Mwenyezi Mungu alisema hivyo.
Isaq is required to raise 1.8 million shillings for specialized treatment in the capital as soon as possible in order to save his life. As he struggles to raise the life-saving operation fees, he has advice for other cancer patients in the area.
Ile fursa ambayo nilipata ni hiyo workshop ambayo mnaeleza tu endoscopy. Kama singeenda leo singekuwa hivi vile mimi naona. Ingepita hiyo stage, ingepita stage nyingine.
One thing today is that most of the cancers in this are preventable. Most of the cancers are treatable if they are diagnosed at early stage.
Locals have started sharing their experiences on the common enemy, throat cancer.
Zamani sisi tulikuwa tunakuanga na shida ya malaria, lakini siku hizi hii ugonjwa ndio imekuwa the order of the day.
The 4 patients who are from one family, I think we usually those incidents are also there. So we can't say exactly the problem was only with that family.
Muhammad Adan, a father of 8 children, found out about the cause of his ailment 3 months ago when his health started to go down.
Alafu kutoka saa hii imezidi, hakuna kitu anaonja. Akikohoa anatoa mate damu kama usa.
This has weakened his already ailing body. This day, Muhammad's brothers carry him to a nearby Somali hut where the verses of the Quran will be recited for him. The Quran is widely used by the pastoralist communities in this area to treat the sick as a last resort after all other options have failed.
Sirani samsaidia kwa maana naomba Mungu. Unajua kila kitu mawezo ni ya Mungu, sio ya binadamu. Binadamu hana mawezo. Unakuomba yeye anaweza kusaidia kila njia. Kama ni kifo mwenyewe ndiye aliunga. Kutumba ya mama nani alikuweka ni yeye. Nani alikupatia kunjia upungue macho si yeye. Lazima tuombe.
Mama Muslima, a typical Somali mother, illustrates the lack of awareness about the dangers of the cancer.
Sasa hospitali Nairobi wanafanya kazi aina gani? Wangapi wanapeleka na wanakufa? Huko wangapi? Halafu sasa unajua tunadhibi nini? Ati achome kwa maana ni vitu. Mtu amekufa saa hiyo. Afadhali tupendwe ndio tuone Mungu amechukua ametubonesha sisi.
They all have one thing in common, but they took different approaches to solving the issue. Mzee Abdullahi Nur Barre, the old man we saw earlier, passed away a week after he was discharged from hospital. Abdi Isaq is preparing for his surgery. Muhammad Adan has turned to spiritual intervention, while Abdi Ahmed Ali once again returned his sick father to his village hundreds of kilometers away.
Setting up a consultancy wing which will be on a collation and referral basis, in the sense that we are trying to accumulate as many cases requiring specialist attendance as possible, and then bring in the specialists themselves here, be they gynecologists, be they ENT and whatever specialists, so that they attend to these cases here. That way we will hopefully reduce the cost of someone having to travel out of here.
Medics in the area and the larger region continue to debate the exact causes of the many incidents of throat cancer problem.
I think there is need to do more research on the association between the incidence of cancer of the esophagus and the environment around here, so that we get the exact link between the cancer of the esophagus and what is predisposing patients around here to get cancer of the esophagus.
The other thing is that our air is extremely polluted. The water sources are also polluted with the radioactive substances. They are polluted with chemicals that are either moving from the factory.
As the debate carries on in hospital among local medical practitioners and residents, one thing remains clear. The treatment of the disease is a costly affair for most of the people here. Nurdin, Elmoge, NTV, Wajir County.